Canadian Institute for Public Safety Research and Treatment is shining a light on first responder mental health ahead of World Mental Health Day, which is in March. Casey Ward is with the Regina Police Service and in studio with us. Casey, thank you so much for being here and for your service.
Thanks for having me.
Listen, you've been with the force for 25 years. I know you've seen some things. How has the conversation around mental health changed in the force?
You know, we're really trying to reduce the stigma with our public safety personnel. Talking to our leaders to make sure that they understand that we need to take care of the people that are out there taking care of our communities.
How has the journey been for you?
Good. I was actually diagnosed with PTSD back in 2021, and I'm okay saying that. There's lots of great things through CIPSRT research and treatment that have helped me get back on my feet and be back supporting our community.
Was there a time when you wouldn't have been okay saying that?
Oh, 100%. When we first started, you would never talk about mental health. It was one of those things you just would, hide and go on about your day. And now we want to get that message out to our people. It's okay not to be okay. There's great things out there to help our members, and come on forward. And there's great supports.
You've been there. How hard is it to just open that dialogue?
In 2020, it was actually quite tough. Being with CIPSRT, I was surrounded by tons of people that could help me, and I didn't want to come forward because of that stigma and thinking people might think a little bit less of me. I was actually running our tactical team at the time, and I was wondering, are they going to take me off the SWAT team? Are they going to, take me off everyday duties and stuff like that? So, but coming forward, the support that I had and the support our members have nowadays is phenomenal, because I think people understand the amount of trauma that our members see day in and day out. We just need to help those people.
Over 20 years doing this, I've seen this conversation, and we've had this conversation, but it's still difficult to reach some officers, some EMS personnel, some first responders. How do you do it?
I think it's by telling our stories. I also think the community supporting our members is a huge thing. When people do come forward to see that support. When I came forward and just saw, our chief, Evan Bray at the time, and our deputy chief, Laura Lee Davies, the support I got, I just felt this is okay. And then myself being able to tell our other members that when I came forward, I was supported so much.
The organization you're here with, CIPSRT, has been around for, I think 18 years or something like that. What's your role with them, and what are you guys trying to accomplish here ahead of World Mental Health Day?
Yeah, I'm actually the co-chair of it, of the Public Safety Steering Committee, which is all the public safety personnel across Canada. It's a great organization. We do leading research and treatment. It's a federally funded program. And, one of the really unique things we do is actually May 5th and 6th, we have a national conference in Calgary where we get all our public safety personnel together to talk about the leading research, how to sleep better, all the things that we deal with day in and day out, and give our people, our members, tools that can help them with every day in their job.
Sleep the hardest part? Because that's when you probably see the stuff again.
100%. And I think we all know, if you don't get sleep, you're a little bit more cranky, and then, a little bit more shorter with your family and, with the public. So with those different shifts and even with trauma, if you're, having reoccurring nightmares and things like that, not getting a good night's sleep, sleep is so paramount in public safety personnel.
About 20 seconds left. If somebody's out there watching and they need some help, how do they get a hold of someone like you that can open up that dialogue?
One of the biggest things is that you can actually go on the CIPSRT website. There's actually assessment tools. There's lots of links to get help. It's one of the best websites I've ever seen, and all our research is on there. But if you need to reach out, there's great places you can. There's Internet Cognitive Behavioral Therapy, PSPNet. That's free of charge. That's right on that website.
Thank you so much for your time, and again for your service.
Thank you very much.